been reported that Ron Bloom, the car czar who came up with the cash for clunkers idea, is about to be appointed a czar to oversee all American manufacturing. It's my understanding he will be the 44th czar. These czars operate outside the law, not accountable in any way to Congress or the will of the American people. They answer only to the president. In my opinion, these czars present a real danger to our nation's freedom, and that they can issue edicts, rules, regulations, and restrict and control actions of America's businesses based on political decisions. What can we do about this?
Well, I have an idea I don't think the president's going to go for, but here's my idea. I want him to appoint me czar over all the czars. I'm going to fire them all and then resign.
Nice to meet you, sir. You said you do not want the government being in charge of our health care. So my question would be, to all the seniors here, all the veterans here, your family here, would that include them? Would you be willing to get rid of all of that government-run health care? As opposed to giving it to me?
Yeah, let me thank you. The government is already in the healthcare business.
Correct.
It's Social Security, Medicare, VA.
It's still working.
My question is, are you willing to tell all the seniors and all the veterans here that you don't want the government running their health care as well?
I'm going to answer your question. Is that that's the question? You know what? I am very concerned about the health care that the government already is doing for our seniors, already doing for our veterans, and already doing for children in Medicaid. There's a lot of waste, there's a lot of fraud and abuse, and all of these programs are going broke. And so what I'm concerned about is that their health care is going to go away, not because we take it away, but because it goes broke, or we start rationing health care. We already have physicians because we keep cutting the reimbursement rates for physicians. Many of you have experienced this as seniors. You try to go see a doctor and that doctor doesn't take Medicare. Some doctors won't take Medicaid.
My parents have the best health care, and they are senior citizens and they have never been denied anything ever.
I have.
Okay. I'm gonna answer your question, but I'm gonna limit it to one question. So I'm gonna wrap this up. So, but what I do get and I do understand is that we want to have a model in this country where health care, and notice I didn't say health insurance, but health care is affordable, available, and accessible to as many Americans as we can. And we can do that. I don't think anybody is trying to argue that there are not room in our current healthcare system for some improvement. There's lots of areas in government that have room for improvement, but I think we owe it to the American people before we throw out completely the baby in the bathwater here to look at some of the things that over the years have been offered up but turned down of ways to make the current system better. And let me just articulate some of those. One of those I would firmly believe in is once you have some health insurance, you ought to be able to take it with you, whether you're in Texas, in New Mexico, or wherever you are. I believe that people with pre-existing conditions, if they desire to have health insurance, we ought to figure out a way to do that in a way that they can have that. I strongly believe that when I go see my doctor that he's trying to make me well and not trying to get sued. So we have to look at some ways to let doctors not have to practice defensive medicine. We also have to preserve individuals' rights, patients' right to make decisions with their doctors and not with the federal government. We have put in place some programs for folks that I have supported that would help folks that are struggling financially. Community health care centers is one way to do that. We have Medicaid, but you know, people say, well, there's so many people uninsured. Well, we have thousands of people in Texas that are eligible for Medicaid that don't sign up for it. We have thousands of children in Texas that aren't under S-chip because they haven't been signed up for it. And so evidently, there is something amiss here why people aren't signing up for something they already have, and how we are going to add more stuff, and then all of a sudden they're going to become interested. I'm not sure that's right. And so my feeling is this is such an important issue that just getting something up on the scoreboard for your administration shouldn't be the goal, but what should be the goal is getting it right for America. And I'm willing to sit down and talk about it.
Hi, Randy. Nathan Lusk.
Thanks for being here.
Thank you. Hey, real quick, before I ask my question, I wanted to say I've been self-employed for a long time. I've never made tons of money. And I took the time to use my freedom and go find health insurance I could afford. And my question, though, is about the bailouts. Our system was founded and is still supposedly a government for the people, by the people, and of the people. Yet when the people said that they disapprove of bailouts, it happened anyway. And I know you voted against it. This isn't, I'm not condemning you. But I'm trying to figure out, since my money paid for these, since I pay taxes, and my money paid for these bailouts, when am I getting my shares of General Motors, my shares of Chrysler, my shares of
Well, and that's the reason I voted against every bailout from the very beginning, is that, you know what, this is America, and sometimes the market is a much better picker of winners and losers than the government. And the day the government started determining which entities got to stay and didn't was a bad day for America, because where do you stop that? And, you know, I'm very concerned about how we're going to get our money back. And in fact, I offered about 5 or 6 amendments during this appropriation season to get some of the stimulus money back. Unfortunately, the Speaker of the House didn't let some of those amendments come to the floor, and some of them that we did bring to the floor, they had enough votes on the other side to do that, to defeat it. But that doesn't stop, and since when we bring Chairman Bernanke up to the Hill, and when we bring Secretary Geithner, time and time again, I have asked them, I asked the previous president, the previous Treasury Secretary, what is your exit strategy? And I'm sorry to tell you, nobody's ever had an exit strategy. So we have to hold these people accountable to make sure that they were very liberal passing that money back, and very aggressive in doing it. I hope they're just as aggressive as getting your money back. And I pledge to you, we're going to keep trying to hold them accountable to do that. Thank you.
First of all, Congressman, thank you for having this meeting. My concern as an American is we just got through up in Washington giving Acorn $11.5 billion. Now, what is going on here? We have nobody standing up and saying anything against it, not anybody in the Republican Party up there. When you have a coon tree, bark. These people are out of control, and ought to be some congressional investigations into this. You've got a devout communist up there that heads up the Green Van Jones, that's appointed, devout communist, been arrested 5 times, got a criminal record, and nobody is doing anything about it. Now, where is our law enforcement on that? I know if I get a ticket downtown Lubbock and I don't pay it and I get stopped, I'm going to get arrested. Now, why isn't that guy having a congressional investigation along with the rest of his appointments? Thank you for your time.